White here, Doctor of Physical Therapy. Today we will be reviewing exercises following a shoulder injury, whether you've had a fall or you've developed pain over time in your shoulder. These exercises are designed to improve the strength, to improve your overall functional mobility so you can reach, do your hair, or even potentially take clothes on and off. Starting with very submaximal exercises in the presence of weak muscles of the shoulder is sometimes where patients have to start. I'm going to be demonstrating how to perform an isometric contraction in the direction of external rotation. I'll be utilizing my right hand as my injured side and my left hand to assist. I'm going to start with my right arm down by my side, my elbow approximately at 90 degrees. My palm will be facing towards my belly, and all I'm going to do is take my left hand, I'm going to hold my right wrist in place, and all I'm going to simply do is try to rotate out as if I was pushing my watch into the palm of my left hand. You're gonna wanna complete about 10 to 30% of your max force that you can generate. This exercise is not designed to produce any pain and is sometimes, performed very lightly for reps of 10 and completion of 2 to 3 sets. Sometimes performance of submaximal exercises needs to be completed with just manual assistance from yourself. I'll be demonstrating how to perform internal rotation in an isometric fashion. I'm going to be utilizing my right hand as the affected side, and my left hand will be the side that is actually going to provide the level of resistance. I'm going to start with my right hand down at my side, my elbow bent at 90, and my elbow facing my belly. Then I will take my left hand, put it very nice and lightly up against the inside of my wrist, holding it in place. This will provide the actual resistance of the exercise. I will then try to pull my palm of my hand of my right hand towards my belly button and then relax, holding for approximately 1 to 2 seconds, generating about 10 to 30% of my max force. This exercise is not designed to produce pain and should be completed in reps of 10 with 2 to 3 sets. Today I'll be utilizing a medium resistance band to demonstrate how to perform resisted shoulder abduction. This is designed to improve the muscle strength in your shoulder. Simply start by grabbing approximately 3 feet apart, taking your opposite hand, putting it on your opposite hip of the shoulder that you're trying to strengthen. You're going to start with your thumb pointed up towards the ceiling. Bring it down by your pocket and then simply lift up and then come back down. And I'll demonstrate again. It's important to note that you want to try and keep your shoulder down and don't let it rise up towards your ear. You can perform this exercise for 10 reps with 3 sets. Today I'm going to be utilizing a medium resistance band to demonstrate external rotation of the shoulder. External rotation of the shoulder is designed to improve muscles of the rotator cuff, specifically the supraspinatus and the teres minor, and then the infraspinatus. Involves by having your elbow here right alongside of you at 90 degrees, bringing your hands close together on the band, and then simply externally rotating or bringing your hands towards your back. You want to make sure that your shoulder blades stay close to your body and your shoulders don't elevate at the same time either. You can perform this exercise 10 times with about approximately 2 to 3 sets. I'm going to be utilizing a medium resistance band to demonstrate how to perform resisted shoulder flexion. This again is an exercise designed to improve the strength of the shoulder and may actually improve the shoulder girdle, which includes some of the pectoralis muscles. I'm going to start by having my hands about 3 feet apart. I'm going to take my opposite hand apart and I'm going to put it on my opposite hip. The side that I'm going to be trying to strengthen will start right at the opposite hip, or the same hip, and you're going to lift up and then come back down, coming up and then coming back down for reps of 10. If you feel that the exercise is too easy, you can bring your hands closer together and repeat. Typically, you're going to be performing this exercise in reps of 10 with 3 sets. I'll be utilizing a medium resistance band to demonstrate resisted internal rotation of the shoulder. This is designed to improve the internal rotators of the shoulder, potentially after a shoulder injury. In order to perform this exercise, you're going to have to tie a knot inside the band. Typically, I like to double it to create a big enough knot because you'll be placing this inside the door. This knot will be designed to hold as you perform the exercise. You're gonna start with your arm right alongside, your elbow at 90, with your palm facing in. Typically, the resistance will be felt throughout the range of motion. If you need to step further away or closer to vary the resistance, or potentially move your hand closer to the door or further away from the door. I'm gonna start right here, and all I'm gonna do is simply try to bring my palm towards my belly button and slowly bring it back. Again, it should be nice and controlled. Your arm shouldn't be wavering or quivering. You're gonna complete 10 reps for typically 2 to 3 sets each. Utilizing a cane is sometimes appropriate if you need what's called active assisted range of motion for the shoulder, designed to improve strength in the presence of extreme weakness. Sometimes individuals aren't able to lift their arm independently, so we use the other limb to assist. Today I'll be demonstrating how to use a cane to demonstrate active assist shoulder flexion. Simply start by grabbing the cane, grabbing approximately 12 to 16 inches apart, and lifting up as high as you can. If you can only lift to even to about 90 degrees with your shoulders and then go back down, that's okay. Simply just trying to progress as tolerated as much as you can until you eventually achieve 180 degrees. This exercise should be performed in reps of 10 and completed with 2 to 3 sets. I'll be utilizing a cane to demonstrate active assistive shoulder range of motion in the direction of called abduction. This can be utilized in the presence of extreme weakness of the shoulder. If my right shoulder was the affected side, I'm gonna take my left hand and grab the cane towards the bottom. I'm gonna try and keep my right elbow as straight as possible and simply try to lift my right hand up as much as I can, using my left hand to assist so I can get my arm up as high as I can. The control should be felt with the left hand doing most of the work. This should not be painful, but if it is, don't go any higher than the pain. Simply attempt to increase the range of motion as you progress through the reps and sets till you achieve approximately 180 degrees. You're gonna try to perform this exercise in reps of 10, completed with 2 to 3 sets. I'm gonna be utilizing this typical stretch strap to perform a very simple strengthening exercise. This strap comes with loops, so it's very, very convenient for you as the patient to perform a sub-maximal isometric contraction in the direction of external rotation. Now that sounds like a mouthful, but it's a very simple exercise. I'm gonna use my right arm as my affected side. I'm gonna simply place my hand inside one of the loops and have the strap provide the resistance on the back side of my palm. I will then use my left hand to provide the level of resistance. It's ideal that your hand does not move during this exercise. What I will try to do is try to push my right hand and the back side of my palm outwards, resisting into the band for a count of 1 to 2, and then relaxing. As you can see, my hand doesn't actually move, which makes it that isometric contraction. This exercise is designed to be very, very pain-free and very, very light. You're gonna wanna complete about 10 reps for 2 to 3 sets. I'm gonna be utilizing this strap, which typically is used for stretching, to perform a strengthening exercise. As you can see, this strap comes with loops individually throughout the strap. I'm gonna use my right arm as my affected side. I'm gonna put my palm of my hand inside the strap. The strap is supported with a small knot, and then it's placed within the door to hold it in place. All I'm gonna try and do is bring my palm towards my belly button. You won't actually see the arm move because it's an isometric contraction. This is designed to improve the strength of your internal rotators. You're gonna complete about a 1 to 2 second contraction for about 10 reps. Again, this exercise should not be painful and is performed with very, very light resistance, approximately 10 to 30% of a max contraction. And you'll want to perform about 2 to 3 sets. I'm going to be utilizing a resistance band to demonstrate shoulder extension. This is designed to improve the strength in some of your postural muscles, as well as some of the muscles of your upper arm. You're gonna locate a door, place the resistance band at the top of the door, and approximately step back just a touch. You're gonna start with your elbows straight out, making sure that they remain locked throughout this. Your thumbs should be pointed up towards the ceiling. All I'm gonna try and do is bring my hands down towards my pockets while my elbows remain locked out. You can always vary the level of resistance by stepping closer to the door for less resistance, or further away from the door for more resistance. Or I can also move my hands closer to the top of the door and complete the exercise as well. This exercise should be completed for about approximately sets of 2 to 3 with reps of 10. Completing the next exercises will be performed in what's called quadruped. Quadruped consists of bringing your wrist equal with your shoulder and then your knee directly underneath your hips. I'll be demonstrating quadruped shoulder flexion with alternating raises. Simply start by lifting one side up off the ground and then returning it back and then lifting the other limb. It's important to note that you should remain relatively flat and imagine your back not moving. You should be able to maintain a glass of water on top of your shoulders or on top of the lower part of your back without it spilling over if you're performing this correctly. This exercise is designed to improve the proprioception of your shoulder, but also approximate the joint at the same time. You should complete this exercise roughly 10 reps on each side for about 2 to 3 sets, and resting as necessary. The next set of exercises I'll be completing will be positioned in what's called quadruped. Quadruped involves positioning your hips and knees in line with each other and your hands and shoulders with each other as if you were performing a tabletop. I will demonstrate the position, and now I will demonstrate the exercise of alternating shoulder flexion. Simply start by lifting one hand up and bringing it back down, and then lifting the other limb back down. It's important to note that nothing should really move other than your shoulder. Your head should be looking down towards the ground, slightly in front of your hands. You should imagine you should be able to maintain a glass of water on the top of your back while performing this exercise. You will want to complete the exercise in reps of 10, typically 2 to 3 sets as needed, or resting as appropriate. I'll be demonstrating how to perform quadruped lateral raises. Simply start by getting in the position of quadruped, as I'm going to demonstrate now. My hips and knees will be in line with each other, and my wrist and shoulders will be in line with each other. Imagine nothing is moving. Start by lifting your side up and then back down, and then transitioning and shifting your weight to the other side. Ideally trying to perform this exercise while maintaining a flat back. The gaze of your eyes should be approximately 4 to 6 inches in front of your hands to prevent any strain on your neck. You'll want to complete this exercise in reps of 10 with 2 to 3 sets, or potentially resting as tolerated. I will now be demonstrating a knee plank, which is designed to improve the stability of your shoulders. Planks aren't just for the core. That's a very common misconception. I will demonstrate this exercise by putting my elbows even with my shoulder, maintaining this position with my knees supported on the ground, starting for about 10-second holds. Progressing the hold up to a minute, but again, you should consult your physical therapist to make sure that that time is appropriate. Once you feel that you have mastered this exercise, simply bring your toes further away from your body and then lift your knees up off, starting for a 10-second hold, progressing to potentially a minute. This exercise should be performed in sets of 2 to 3, progressing duration as tolerated. I'll be demonstrating what's called knee push-ups. Knee push-ups strengthen the entire shoulder girdle after a potential injury. You're gonna start just by having your knees as your support. Extend your body forward, having your hands about shoulder width apart, potentially a little bit wider. Keeping your head nice and flat, not trying to overextend to prevent any neck pain. Bring your knees back as appropriate or what feels comfortable. Simply bend your elbows, go all the way down, and then all the way back up. If you want to make the exercise a little bit harder, you can hold and then repeat. Once you've mastered this, you can then progress to a full push-up. Simply go up onto your toes, keeping your butt tucked down. Go down to 90, and then back up. Repeating this for approximately 10 reps for 2 to 3 sets or as tolerated. A very high level closed kinetic chain exercise is the push-up plank alternating lift and lowering exercise, as I'm currently going to demonstrate today. This exercise is very high level and should be only performed if your physical therapist deems it's appropriate. It involves a lot of upper body strength, so again, clear it with your physical therapist. I'm going to start in the full push-up position, and then I'm going to go down onto my right elbow, then down onto my left elbow, up onto my left hand, up onto my right hand. I will then alternate and go down on my left elbow, down on my right elbow, up on my right hand, up on my left hand. If performing this exercise correctly, your trunk should not really move. To make the exercise harder, you can change the surface or potentially change the speed in which you perform. Typically, you'll complete this exercise for a total of 10 reps and then take a break for 2 to 3 sets. I'm going to be utilizing this resistance band to show a varied version of what I call lateral taps. You're going to start in the quadruped position. So again, your hips and knees will be in line with each other. Your hands are going to be directly over your shoulder to start. I'll show you the progression to increase the level of difficulty with this exercise. Simply start in the simple quadruped position. You want your hands approximately 12 inches apart. I'm going to demonstrate on the left-hand side, maintaining my trunk nice and stable. I will reach out laterally to the side and then back in, and then alternate onto the right and then back in. This is the in and out version. I can progress by doing the out-out, in-in version, which will demonstrate with an out on the left and a hold, out on the right and hold, in with the right, in with the left. In order to make the exercise more difficult, I'm going to lean forward with my hands, putting more of my weight down through my shoulder girdle. I can then complete in and out, alternating, or I can do the out version. And then I can also do out on the right and in, or out on the right, out on the left, in. This exercise will be completed in reps of 10 for 2 to 3 sets. Lateral raises utilizing a resistance band is a very simple exercise that can be performed at home. Simply start with a very long resistance band, place it underneath, stepping fully on top of the band to make sure it doesn't slap up or move during the exercise. Your palms will be facing down the entire time, leaving your hands just nice and relaxed, gripping onto the band. Start by raising your arms up to approximately 90 degrees and then lowering back down. It's important to note that your shoulders should not elevate towards your ears during this exercise, and you want to make sure that your hands are remaining in line with your shoulder as if you were standing right in front of a piece of glass, not touching the glass. You can complete this exercise in the version of 10 reps for 2 to 3 sets to strengthen the muscles of the shoulder girdle. Resisted shoulder flexion involves having a nice long resistance band, placing it underneath your feet completely to make sure it doesn't move during the process of the exercise. You're going to perform this exercise with both arms at the same time. Important to note that your elbows should remain locked throughout the entire process. I'm simply going to start with my palms facing down, raising to approximately 90 degrees to start, and then lowering controlled on the way back down. If that exercise is not hard enough, you can try to raise your hands higher, or you can move your hands closer to your feet along the band to add a little bit more resistance. Again, making sure that your palms are facing down, your shoulders are not elevating towards your ears during the exercise, and you'll complete for reps of 10 for 2 to 3 sets. I'm going to be utilizing a resistance band to show how to do external rotation in what's called the 90-90 position. I'm also going to be seated on top of a ball in order to activate and engage my core. This is an exercise that I like to prescribe for pitchers, quarterbacks, or individuals who throw an object during their sport. I'm going to start by holding on to the edge of the band, lifting my arm out laterally to the side, making sure it's even with my body, making sure my shoulder and elbow are aligned with each other, and simply externally rotate while maintaining that position, slowly, and then lowering back down. You're going to want to make sure that the exercise is performed with control and not bouncing like this. If it is, that's too much resistance, and you want to lower the resistance. I'm typically going to perform this exercise for reps of 10 with 2 to 3 sets. If you have a partner at home or a teammate, you can actually have that patient move the ball to make your core engage a little bit more. An exercise that I like to perform that assists with muscle performance or endurance is simply the wall washes, or wax on, wax off. I'm going to demonstrate here with my right arm. Imagine my hand was supported by the wall. You can use a towel, you can use a ball, something that is going to give you some degree of support. Simply start with your shoulder even with your hand at about 90 degrees, and you're going to perform clockwise circles for 30 seconds, initially followed by counterclockwise circles for 30 seconds. Another exercise that I like to do while the patient has their hands supported on the wall is to write the alphabet, simply starting with the letter A through B, C, and then so forth. I can also then have them lead right into lowercase letters or start from 1 to potentially 30. That's designed to work on very, very small stabilizing muscles of the shoulder, but also work on muscle performance and endurance as if you were washing over your head, washing your hair, or performing any extended task over your head. An exercise that I like to perform to improve thoracic mobility, to improve end range, shoulder range of motion, is while performing it on top of a foam roller. I'm going to start with my butt and heels fully supported. My hands are going to be cradling my head, and all I'm simply going to do is extend over the back of the foam roller. And then come back up. It's important that you don't want to pull on your head as if you were doing a sit-up, but use your abdomen to help pull you up. You're going to want to repeat this exercise rather than sustain it, just because it is pretty aggressive. You can also mobilize yourself in a different spot by bringing your heels closer to your butt and then extending over the new position of the foam roller. It's important to note that you should ask your physical therapist if this is appropriate, and always check your baselines before and after. I'll now be demonstrating how to perform passive shoulder flexion range of motion. All it simply involves is sitting next to a table, having a foam roller, and then sitting down in the chair. This is really, really good exercise to start if you're having a lot of pain and you need to get your arm moving. Simply start by placing the affected side up onto the foam roller, and you're going to use your opposite hand or arm and body as the driver of the exercise. I'll place that hand on top of the foam roller, and all I'm going to do is simply lean forward as far as I can tolerate and then come back. If you feel that you need to get a further stretch, simply start by just having the foam roller a little further out and less of your hands initially supported. And rolling forward and then returning back. You rather repeat this exercise than sustain the exercise, just because of the potential pain that might be involved with this. It's important to note that you want to consult your physical therapist to make sure that it is an appropriate exercise to you to perform. I'll now be demonstrating how to do passive range of motion for shoulder abduction. I'm going to start with a table, a counter, somewhere where I have a nice flat surface, the foam roller, and then sitting down in a chair. We're going to demonstrate this exercise if my left side was my affected side. I'm going to start by placing my hand on the foam roller, and it should be in line with my body. Then I'll start by using my body as the driver of the force by leaning away and then coming back. You won't get to end range shoulder abduction. Again, this is just the initial exercise to start getting you moving in that direction. You want to make sure that you don't have too much pain during the exercise, and you want to consult your physical therapist to determine if it is appropriate for you to be performing. Thank you for watching Vive Health shoulder strengthening exercises. As always, if any of the exercises produce any pain, you should stop them and potentially consult your physical therapist or your doctor. It's important to note to start slowly with the resistance in a lower number of reps, and again, and progress as appropriate.